From New York City, the epicenter of the pandemic, this is Democracy Now!
I cannot breathe.
I can't breathe. That's what George Floyd, an unarmed African-American man, repeatedly told a white Minneapolis police officer who pinned him to the ground Monday with a knee on his neck. Video of the police attack went viral. Now 4 officers have been fired.
Being black in America should not be a death sentence. For 5 minutes, we watched as a white officer pressed his knee into the neck of a black man. For 5 minutes.
The killing of George Floyd comes as another video went viral of a white woman calling the officers on a black man in New York City's Central Park, falsely accusing him of threatening her life after he asked her to leash her dog. We'll get response from Ibram X. Kendi, founding director of the Anti-Racist Research and Policy Center at American University, National Book Award-winning author of Stamped from the Beginning, The Definitive History of Racist Ideas in America, and How to Be an Anti-Racist. We'll also talk to him about his new COVID racial data tracker. Then calls for ICE to release people from detention during the pandemic are growing as 2 people have died from the virus while in custody. We'll look at how one of them suffered horrifying neglect.
Like, he was so sick and he kept complaining about it. He wouldn't come out of the room. And the only thing that they would do when he complained, they would take him to sick call, and the only thing they would give him is pain medication or a cold medicine.
All that and more coming up. Welcome to Democracy Now!, democracynow.org, The Quarantine Report. I'm Amy Goodman. In Minneapolis, police fired tear gas and rubber-coated bullets at thousands of demonstrators who gathered Tuesday to protest the killing of George Floyd, an African-American man who was killed by a white police officer Monday. A video circulated widely on social media shows Floyd gasping for air and telling officers, "I can't breathe," while Officer Derek Chauvin pins him to the pavement with a knee to his neck. A warning, the video is extremely graphic.
Your knee on his neck. You got your feet right on his neck. I cannot breathe. I cannot breathe. You just a grown, you're a tough guy. You're a tough guy, huh? I say you're a tough guy. You're not even resisting arrest, bro.
His whole nose is
fight with him. Bro, but why you just sitting there? He ain't doing nothing now. Put him in the car.
It'll kill me.
Officer Chauvin continued to pin Floyd to the pavement with his knee for several minutes, even after Floyd became silent and still. George Floyd was taken to the Hennepin County Medical Center, where he was pronounced dead. The 4 officers involved in George Floyd's killing were fired Tuesday. The FBI's launched a federal civil rights investigation. Minnesota authorities are also investigating. After headlines, we'll get the latest from Minneapolis and speak with Professor Ibram X. Kendi, founding director of the Anti-Racist Research and Policy Center at American University. As the official U.S. death toll from COVID-19 is set to top 100,000 this week, rates of child hunger are soaring across the United States. Despite the surge, a federal program to feed school children who've been cut off from school meals during the pandemic has reached only a small fraction of the 30 million students it was intended to help. The New York Times reports only 15% of eligible children have received benefits under the pandemic EBT program, even though a fifth of U.S. mothers in a recent survey reported their children are not getting enough to eat. Meanwhile, the Census Bureau reports more than a third of all U.S. adults are showing signs of clinical anxiety or depression during the pandemic. That figure is about double the rate found in a survey in 2014. Here in New York, Governor Andrew Cuomo rang the opening bell Tuesday as the New York Stock Exchange partially reopened its floor to trading for the first time in over 2 months under new social distancing rules. The Guardian reports Governor Cuomo signed legislation last month quietly shielding hospital and nursing home executives from the threat of lawsuits stemming from COVID-19. The move came less than 2 years after the Greater New York Hospital Association poured more than $1 million into a Democratic committee backing Cuomo's re-election campaign. Meanwhile, the New York Taxi Workers Alliance has joined a lawsuit by Uber and Lyft drivers against Governor Cuomo and New York's Labor Department. The drivers say they were denied unemployment benefits during the pandemic. The Republican governors of Florida and Georgia have offered to host the Republican National Convention in August after President Trump threatened to pull the convention from Charlotte if North Carolina cannot guarantee he can have a packed arena. This comes as North Carolina is seeing a surge in coronavirus cases. On Tuesday, North Carolina's Democratic Governor Roy Cooper responded to the president.
I will say that it's okay for political conventions to be political, but pandemic response cannot be. We're talking about something that's going to happen 3 months from now, and we don't know what our situation is going to be regarding COVID-19 in North Carolina.
In Yemen, the United Nations says an explosion of COVID-19 cases has pushed an already strained healthcare system past the breaking point. This is a spokesperson for the UN Office for the Coordination of Humanitarian Affairs.
The situation is extremely alarming. They are talking about that the health system has, in effect, collapsed. They are talking about having to turn people away because they do not have enough oxygen. They do not have enough personal protective equipment.
Officially, Yemen has confirmed just over 200 cases of COVID-19 and 42 deaths. But Yemen has one of the lowest COVID-19 test rates in the world, with just 31 tests per 1 million residents. In the port city of Aden, epidemiologists have counted a 5-fold increase in new grave sites this month over May of last year. Yemen's already suffering the world's worst humanitarian catastrophe, with some 80% of Yemenis reliant on humanitarian assistance after years of U.S.-backed, Saudi-led war. In India, some hospitals in Mumbai have begun turning away patients amidst an explosion in new COVID cases. On Tuesday, India confirmed over 7,000 positive tests for the coronavirus in just 24 hours, a record pace. Despite the surge, India resumed domestic air travel this week, with flights taking off under new social distancing guidelines. In China, officials in Wuhan say they're wrapping up a program to rapidly test virtually the entire city's 11 million residents for coronavirus. Over 1 million people were tested Saturday alone, more people than were tested across the United States in the entire month of March. In South Korea, officials reported 40 new cases of coronavirus Wednesday, the largest jump in nearly 2 months. After a recent outbreak tied to nightclubs in Seoul, South Korea tested over 80,000 people, finding 247 cases linked to just one individual. About 30% of those testing positive had no symptoms. In Ecuador, thousands of people took to the streets Monday in cities across Ecuador protesting President Lenin Moreno's public spending cuts during the pandemic. At least 150,000 people in Ecuador are now unemployed, with unions saying low-income workers have received little or no aid, while the rich are being protected. At least 2,000 marched in the capital, Quito. Marches also took place in the city of Guayaquil, the epicenter of the pandemic in Ecuador. In Mexico City, healthcare workers blocked main roads Wednesday, demanding the government provide them with personal protective equipment amidst the ongoing epidemic.
We are asked to reuse our uniforms, that we should use cotton, to wash or reuse our N95 masks after several of my colleagues have become infected and even died. They have even died. So we want the authorities to listen to us. We want equipment to be able to work.
In the United States, President Trump accused a reporter of trying to be politically correct for wearing a face mask during a press briefing at the White House Tuesday. Trump's comment came a day after he shared a tweet mocking Joe Biden for wearing a mask during a Memorial Day event in Delaware.
Biden can wear a mask, but he was standing outside with his wife, perfect conditions, perfect weather. They're inside, they don't wear masks, and so I thought it was very unusual that he had one on, but I thought that was fine. I wasn't criticizing him at all. Why would I ever do a thing like that? And your second question was? I couldn't hear you. Can you take it up because I cannot hear you?
I'll just speak louder, sir.
Oh, okay, good. You want to be politically correct. Go ahead.
No, sir, I just want to wear the mask.
President Trump was speaking during an event protecting senior citizens' health. Meanwhile, Joe Biden called Trump a, quote, absolute fool and said his refusal to wear face masks is, quote, stoking deaths. President Trump is threatening to shut down social media platforms after Twitter labeled two of his tweets as potentially misleading. On Tuesday, Trump sent out two tweets attacking mail-in voting, claiming it would lead to a rigged election. Twitter responded by adding fact-check labels to the tweets with information about how there's no established link between voting by mail and voter fraud. Trump responded by accusing the company of interfering in the 2020 election and of stifling his free speech. Earlier this morning, Trump wrote on Twitter, Republicans feel that social media platforms totally silence conservative voices. We will strongly regulate or close them down before we can ever allow this to happen, the president said. Amazon is holding its first virtual shareholder meeting today, with some shareholders calling on the retail giant to address worker safety issues. At least 8 Amazon warehouse workers have died of COVID-19. Meanwhile, Amazon recently attempted to improve its image by distributing a video package to local news outlets praising the company's response to the pandemic. At least 10 stations aired the Amazon propaganda video as a news item.
Millions of Americans staying at home are relying on Amazon.
Millions of Americans staying at home are relying on Amazon.
Millions of Americans staying at home are relying on Amazon.
Millions of Americans staying at home are relying on Amazon.
New York, a video has gone viral showing a white woman calling the officers on a black man and falsely accusing him of threatening her life after he asked her to leash her dog in Central Park. Christian Cooper, a writer, editor, avid bird watcher, board member of the New York City Audubon Society, filmed on his smartphone as the woman, Amy Cooper, no relation, dialed 911 to report him.
There is an African-American man. I am in Central Park. He is recording me and threatening myself and my dog. And my... I'm sorry, I can't hear you either. I'm being threatened by a man in the ramble. Please send the cops immediately.
The woman, Amy Cooper, has since been fired by her employer, investment company Franklin Templeton. She's also had to surrender her dog to the shelter it was adopted from. Amy Cooper has since publicly apologized, telling CNN, quote, I'm not a racist. I did not mean to harm that man in any way. I think I was just scared, she said. And Costa Rica has become the first country in Central America to legalize marriage equality. The landmark ruling went into effect midnight Tuesday, 18 months after the Costa Rican Constitutional Court ordered lawmakers to implement the reform. Small ceremonies took place shortly after, respecting the country's coronavirus restrictions. Daritza Araya and Alexandra Quiros were the first couple to marry in the early hours of the morning. And those are some of the headlines. This is Democracy Now!, democracynow.org, the Quarantine Report. I'm Amy Goodman in New York City, the epicenter of the pandemic, with my co-host Juan Gonzalez joining from his home in New Brunswick, New Jersey, the state still with the second highest number of reported COVID infections and deaths. Hi, Juan.
Hi, Amy, and good day to all of our listeners and viewers across the country and around the world.
Well, we're going to Minneapolis right now, where police fired tear gas and rubber-coated bullets at thousands of demonstrators who gathered Tuesday to protest the killing of George Floyd, a 46-year-old African-American man who died in police custody Monday after a white police officer pinned him to the ground. A video circulated widely on social media shows Floyd gasping for air, saying, "I cannot breathe," while Officer Derek Chauvin holds a knee to his neck, a warning the video is extremely graphic.
Yeah, you got your feet right on his neck. He ain't even resisting the rest.
I cannot breathe.
You just a grown, you're a tough guy. You're a tough guy, huh? I say you're a tough guy. You're not even resisting the rest, bro.
His whole nose is
fought with him? Bro, but why you just sitting there? He ain't doing nothing now. Put him in the car.
It'll kill me.
The video shows the officer continued to pin George Floyd to the pavement with his knee in over his neck, even after Floyd became silent and still. 4 officers involved in Floyd's killing were fired Tuesday. The FBI has launched a federal civil rights investigation. Minnesota authorities are also investigating. "I can't breathe" were the same last words Eric Garner said before he was killed by a police officer in Staten Island in 2014. This is Minneapolis Mayor Jacob Frey.
Whatever the investigation reveals, it does not change the simple truth that he should be with us this morning. I believe what I saw, and what I saw was wrong at every level. Being black in America should not be a death sentence. For 5 minutes, we watched as a white officer pressed his knee into the neck of a black man. For 5 minutes. When you hear someone calling for help, you are supposed to help. This officer failed in the most basic human sense. What happened on Chicago and 38th, this last night, is simply awful. It was traumatic, and it serves as a clear reminder of just how far we have to go.
George Floyd's family says the officer should be charged with murder. They're being represented by civil rights lawyer Benjamin Crump, the family is, who said, quote, "This abusive, excessive, and inhumane use of force cost the life of a man who was being detained by the police for questioning about a nonviolent charge." This is Floyd's brother, Philanese, speaking on CNN Tuesday.
I love my brother. Everybody loves my brother. Knowing my brother is to love my brother. They could have tased him. They could have maced him. Instead, they put their knee in his neck and just sat on him and didn't care at all. He screamed, "Mama, mama, I can't breathe. I can't breathe." And they just didn't care. So I just don't understand what more we got to go through in life, man. They didn't have to do that to him.
Well, for more, we're joined by Dr. Ibram X. Kendi, professor of history and international relations, founding director of the Anti-Racist Research and Policy Center at American University, National Book Award-winning author of Stamped from the Beginning, The Definitive History of Racist Ideas in America, his latest book, How to Be an Anti-Racist. His forthcoming children's book is titled Anti-Racist Baby. It's great to have you with us, Professor Kendi, but under terrible circumstances, from the pandemic to what we just see happened in Minneapolis. Can you respond to the killing of George Floyd?
I mean, I think like so many Americans, so many Black Americans in particular, I'm just completely outraged. And it's certainly the case, as the mayor said, that when we cry out for help, other human beings should seek to help us. But essentially, the job of a police officer is to listen to those calls for help, is not to be our executioners. And so the fact that a police officer did not hear the cry for help, that's even worse than any of us. We're not sworn to protect. We're not trained to hear those cries, but police officers are. And so to me, I'm outraged, like so many people who care about Black lives.
And Professor Kendi, in this particular case, the actions of the mayor, not only in immediately firing the officer involved, but also the 3 other officers who were on the scene. So often, many of these cases of police abuse depend on the officer being able to get away with it because other members of the force, in essence, back them up through the blue wall of silence. So your reaction to how the city immediately moved on this case?
So, I mean, I think obviously their firing was immediately warranted. I think they should also be seeking to charge the officers with murder. I also think that we really need to consider if we did not have a video, would the officers have been fired as quickly? Would they have believed all of those witnesses who were looking at what was happening and who was asking the officers to stop? But it's not enough to fire the officers. You literally need to root out other officers in the Minneapolis police force that have the capacity to do this. I mean, and just like all over this country, it's not enough to imagine that there are bad apples. You know, we need to recognize that there's something wrong with the tree.
I wanted to read Bernice King's tweet, the youngest child of Dr. Martin Luther King Jr. and Coretta Scott King. She tweeted a picture of Minneapolis police officer Derek Chauvin with his knee on the neck of George Floyd next to a picture of Colin Kaepernick taking a knee to peacefully protest deaths like this, for which he's banned from the NFL. Next to the pictures, King wrote, quote, "If you're unbothered or mildly bothered by the first knee, but outraged by the second, then in my father's words, you're more devoted to order than to justice," she said, and more passionate about an anthem that supposedly symbolizes freedom than you are about a black man's freedom to live, was her final part of that tweet. Dr. Kendi, talk about that.
Oh, I just think it was a powerful, powerful statement. And, you know, speaking certainly not only to her father's legacy, but even Dr. Bernice King's analysis, you know, of the situation. I mean, fundamentally, Colin Kaepernick was kneeling for the freedom to live, you know, for the freedom to have equity, even from the freedom, as he would, I suspect, say now, from infection. I mean, you know, black people are, you know, we're not only we were running from racist terror, you know, only to run into the face of COVID-19, only to run from COVID-19 into the face of racist terror.
And Ibram Kendi, I wanted to ask you about the second video that we mentioned that went viral over Memorial Day weekend of this Amy Cooper, this New York resident in Central Park, falsely calling police on Christian Cooper. When he urged her to leash her dog and claiming he was assaulting her. Franklin Templeton, the investment firm, subsequently fired her. Interestingly, Franklin Temple is the same investment firm that fought the government of Puerto Rico over its bankruptcy, had no problem with creating massive distress for millions and millions of Puerto Ricans during their crisis, but now, because of the bad publicity, immediately fired Amy Cooper. Your response to that particular incident? And
let's go to a clip of what exactly happened. This clip filmed by the man, Christian Cooper, no relation to Amy Cooper, a writer, editor, and avid bird watcher, board member of New York City Audubon Society, who filmed this.
Would you please stop? Sir, I'm asking you to stop.
Please don't come close to me.
Sir, I'm asking you to stop recording me.
Please don't come close to me.
Please take your phone off.
Please don't come close to me.
I'm taking a picture and calling the cops.
Please call the cops. Please call the cops.
I'm going to tell them there's an African-American man threatening my life.
Please tell them whatever you like.
Excuse me? I'm sorry, I'm in the Ramble, and there's a man, African-American, he has a bicycle helmet. He's recording me and threatening me and my dog. There is an African-American man, I am in Central Park. He is recording me and threatening myself and my dog. And my... I'm sorry, I can't hear you either. I'm being threatened by a man in the Ramble. Please send the cops immediately. I'm in Central Park in the Ramble. I don't know.
Thank you.
Incident involving Amy Cooper and Christian Cooper. When the police arrived on the scene, they arrested no one and issued no summons. Your response, Ibram Kendi?
Well, I think first and foremost, it's critical for us to recognize that oftentimes, too often, what Amy Cooper did is typically the beginning of racist terror. And what happened to the end. In other words, you have a white woman weaponizing her white womanhood. And instead of seeking to resolve a dispute with another person and actually follow the rules and leash her dog, instead she projects herself as the victim and then calls the cops through that projection so they can come and protect her. And then oftentimes those cops actually believe that this white woman is being threatened by this so-called super predator of an African-American male. And then oftentimes, or too often, it leads to that unarmed victim ultimately becoming harmed or even killed. I mean, the fact that we're talking about these two stories on the same day, obviously did not lead to, he is safe. Too often it leads to people being harmed. And I don't think white women should have the power to do that anymore.
Ibram Kendi, we're going to break, and then we're going to go back to you to talk about this COVID racial tracker that you've developed. Ibram Kendi is a professor of history and international relations and founding director of the Anti-Racist Research and Policy Center at American University in Washington, D.C. Also National Book Award-winning author of Stamped from the Beginning, The Definitive History of Racist Ideas in America, and his latest book, How to Be an Anti-Racist. Stay with us. Miles Davis's All Blues, featuring drummer Jimmy Cobb. He passed away Sunday at the age of 91 of lung cancer. This is Democracy Now!, democracynow.org, The Quarantine Report. I'm Amy Goodman with Juan Gonzalez as we continue our discussion with Dr. Ibram X. Kendi, award-winning author, professor, history and international relations, founding director of the Anti-Racist Research and Policy Center at American University. Let's turn now to the staggering toll the coronavirus is taking on African Americans in the United States. According to the COVID Racial Data Tracker, a collaboration between the Atlantic and the Anti-Racist Research and Policy Center, over 20,000 black people have died due to COVID-19 infection at a rate nearly twice that of the population share in the United States. This coming as the total U.S. death toll is at just about 100,000, and states rush to reopen their economies despite massive loss of life and warnings from public health experts. Dr. Kendi, can you explain the COVID Racial Data Tracker?
Sure. So in early April, only a handful of states had even released racial demographic data. So I called and other people started calling for racial data. And so by the second week, more states were releasing this data. And so we decided, my colleagues at the Anti-Racist Research and Policy Center started partnering with folks at the COVID Tracking Project to build what we call the COVID Racial Data Tracker. And that was essentially to collect all of this data that was finally beginning to release by states all over this country. But not only that, to continue to advocate for more states to release data and to collect it, to ingest it, and to, of course, make it available for everyday Americans so they can see racial disparities that are persisting to this day all over the country, and then hopefully use this data to protect and create policy for the most vulnerable communities, because all over the country, Black people are disproportionately dying. Latinx people are disproportionately infected. Native people in states like Arizona are disproportionately dying, and even Asian Americans in places like Alaska, Native Hawaiians are disproportionately infected in Hawaii. People of color are disproportionately being impacted by COVID-19, as the data shows.
And Dr. Kendi, in New York City, obviously, was the epicenter of the virus in the United States. And initially, there was a lot of attention focused on Manhattan and people fleeing Manhattan. Then the focus shifted to Queens. But ultimately, now it's been clear that the hardest hit area of New York City, as I had suspected all along, was the Bronx, where 90% of the population is African American and Latino. And that is by far has the most percentage of infections, of deaths, and your sense of how the focus of the coverage of the pandemic has been in the U.S.
Well, I mean, I think that early on the coverage was, this is the great equalizer. And it certainly is the case that every American, no matter their race and even obviously now their age and ethnicity and gender, can be infected, can die of COVID-19. But it seems like at least by the latter part of March, certainly by early April, that it was Latino Americans and African Americans and Native Americans in particular who were disproportionately being infected and dying. And it really had to take many grassroots folks to begin demanding for racial data to even see this, because the states were refusing to do it. Now, I will say many journalists as well, particularly in states all over this country that we've worked with, also made demands of their states to release the data. And then it began to start to roll out just how this was not the great equalizer.
I wanted to ask you about the Trump administration's push to reopen the country. This is top White House economic advisor Kevin Hassett speaking to CNN Sunday.
Our capital stock hasn't been destroyed. Our human capital stock is ready to get back to work. And so that there are lots of reasons to believe that we can get going way faster than we have in previous crises.
In response to this, Professor Kendi, you tweeted, "This is jarring because my enslaved ancestors were literally human capital stock. No matter what, they were always told to go back to work. This could be 1820.
I mean, it's devastating. And I think for any American, Republican, Democrat, middle income, low income, poor, Black, white, Latino, I think this should be an indication of what the Trump administration thinks about you, that essentially they're driving you back to work so they're benefactors, so they can make money. And it's just that simple. You are literally an entity. You are literally capital, just as my enslaved ancestors were. And this isn't, this isn't hyperbole. In 1860, 4 million enslaved people were worth more than any other body, anything in this country. You had slave owners borrowing the number of enslaved people they had. They were using enslaved people as collateral. And ultimately, they recognized that their wealth, their capital came as a result of the labor of those people, just as they see that today.
And I wanted to ask you also about the institutional populations that have been so hard hit, both in the prison and jail systems in the country and in senior citizen homes. Again, the racial disparities are so stark that even among the elderly, those who were in senior citizen centers that were, in long-term facility centers that were largely African-American and Latino have a far higher death rate than those who were in long-term care facilities that were largely white.
Yeah, so I think it's certainly important for us to recognize that people of color are being disproportionately infected and killed by COVID-19. But I think it's important for us to also specialize what groups of people of color are being hit the hardest. And so without question, senior citizens of color, their homes are more likely to be sites of outbreaks than the majority white homes. Certainly incarcerated people, and not just incarcerated people in jails, but even people who are being held by ICE are also being infected. And even the homeless population, undocumented people. I mean, this is, all of the people who have been driven to the bottom of this society are the people who are literally suffering in the shadows. And we need to pull them out of the shadows and defend them.
And as the administration and the numbers go to 100,000, clearly the number is far higher because, among other things, of the number of people who've died at home and not been counted. And they definitely fall within the populations you're tracking, Professor Kendi. The Trump administration has resorted to blaming the dead, particularly African Americans, for the sky-high death rate. This is Health and Human Services Secretary Alex Azar speaking with CNN's Jake Tapper.
Unfortunately, the American population is a very diverse and it is a population with significant unhealthy comorbidities that do make many individuals in our communities, in particular African American minority communities, particularly at risk here because of significant underlying disease health disparities and disease comorbidities, and that is an unfortunate legacy in our healthcare system that we certainly do need to address. But no, the response here in the United States has been historic to keep this within our healthcare capacity. Even in New York City, to keep this within capacity is genuinely a historic result.
I want to give you an opportunity to clear it up, because it sounded like you were saying that the reason that there are so many dead Americans is because we're unhealthier than the rest of the world, and I know that's not what you meant.
No, I think that we have a significantly disproportionate burden of comorbidities in the United States: obesity, hypertension, diabetes. These are demonstrated facts that do make us at risk for any type of disease burden.
Sure, of course, but that doesn't mean it's the fault of the American people that our government failed to take adequate steps in February.
That's Trump official Alex Azar speaking to Jake Tapper on CNN. Your response, Professor Kendi.
So what's fascinating is by the second week of April, when more and more Americans realized that black people were disproportionately dying, the first way to blame black people was to say they were not socially distancing. They were not taking the virus seriously. Survey data a month earlier had already disproven that. But then it was hard to also make that case when white Americans overwhelmingly were protesting to reopen their state. So then it became they zeroed in on this idea that black people have greater underlying conditions. The problem with that argument is studies have shown that what's more predictive of black infection and death rates are access to medical care, access to high-quality health care, I should say access to health insurance, even air and water pollution, employment status. All these social determinants of health are actually more predictive of black death and infection rates than their underlying conditions.
Let me finally go to Democratic presidential candidate Joe Biden, who has since apologized, but after facing a backlash for telling radio host Charlemagne the God he, quote, ain't black if he supported Trump. Well, this is specifically what he said.
You got more questions, but I tell you, if you have a problem figuring out whether you're for me or Trump, and you ain't black.
It don't have nothing to do with Trump. It has to do with the fact I want something for my community. I would love to see.
Take a look at my record, man. I extended the voting rights 25 years. I have a record that is second to none. The NAACP has endorsed me every time I've run. Come on.
So that's Biden on the Breakfast Club speaking with Charlemagne. He apologized during a conference call with the U.S. Black Chambers. Your final response, Professor Kendi.
Was, as Charlemagne said, it doesn't really have to do with Trump, particularly for young black voters who I call the other swing voters. And these are typically voters who are swinging between voting Democrat or not voting at all, or even third party. And so they're trying to decide whether they're going to vote for Biden. Trump for them is not an option. And so when Biden says something like, well, if you vote for Trump, then you're somehow not black, I think not only is it extremely harmful because black people are very sensitive about who's black. I mean, it's almost at the level of talking to us about slavery. But then also he doesn't recognize that he's running against himself with young black voters who voted for Obama and didn't vote in 2016.
We want to thank you so much for being with us. Ibram X. Kendi, Professor of History and International Relations, Founding Director of the Anti-Racist Research and Policy Center at American University in Washington, D.C., National Book Award-winning author of Stamped from the Beginning, The Definitive History of Racist Ideas in America, also How to Be an Anti-Racist. We look forward to your children's book, which many parents can read to their kids. Sheltering in Place. It's titled Anti-Racist Baby. All the best to you and your family, Ibram. This is Democracy Now!, democracynow.org, the War and Peace Report. When we come back, we'll talk about deaths in custody, in ICE custody. Why are tens of thousands of immigrants still being held there during this pandemic? Stay with us.
Vou mostrando como sou e vou sendo como posso, jogando meu corpo no mundo, andando por todos os cantos e pela lei natural dos encontros. Eu deixo e recebo um canto e passo aos olhos nus, ou vestidos de lunetas, passado, presente, participo sendo o mistério do planeta. O tríplice mistério do stop, que eu passo por e sendo ele no que fica em cada um. No que sigo meu caminho e no ar que fez, que assistiu. Abra um parênteses, não esqueça que independente disso, eu não passo de um malandro, de um moleque do Brasil, que peço e dou esmolas, mas ando e penso sempre com mais de um, por isso ninguém vê minha sacola. Bem, boy, bem, bottom, bem, bem. Tupirapó, birapumbaia, bem, olha, tapumbaia, bundera, ó, birapumbaia, bundem. Ai!
Mystery of the Planet by Moresh Moreira, who passed away in April. This is Democracy Now!, democracynow.org, the Quarantine Report. I'm Amy Goodman with Juan Gonzalez. Calls for ICE, that's Immigration and Customs Enforcement, to release people from detention during the pandemic are growing after a second person died from the virus Sunday while in custody. A 34-year-old Guatemalan man named Santiago Batan Oxlaj reportedly passed away due to COVID-19 after being detained at the Stewart Detention Center in Lumpkin, Georgia. ICE said he died at a hospital in Columbus after being transferred there on April 17th. Human rights advocates are calling for an investigation, say guards at Stewart have used SWAT-like teams to stop people there who tried to go on hunger strikes to call for their release amidst the pandemic. Batan Oxlaj is the second known person to die of COVID-19 in immigration custody. The first was 57-year-old Carlos Ernesto Escobar Mejia, who came from El Salvador with his family in the 80s. During the country's U.S.-backed civil war. He was the youngest of 5 siblings, the only one who hadn't been able to obtain permanent residency. Escobar Mejia had been detained at the for-profit Otay Mesa Detention Center near San Diego since January. The jail has the largest coronavirus outbreak of any ICE jail in the country. When he died, Escobar Mejia had reportedly been in the hospital on a ventilator for over a week. This is asylum seeker, Oscar Navarez-Diaz, who's jailed at Otay Mesa. He could face retaliation for speaking out, but he described what happened.
We have had one individual pass away. He was our friend. He was here in Mike Pod with me and the rest of the individuals here in Mike Pod. He was an older gentleman. His name is Señor Escobar, Carlos Escobar. He had underlying health conditions, and he had more than a month complaining to the medical staff that he was sick. He would be in and out of medical. First of all, he's a person that had diabetes, and he had part of his foot had been chopped off, and he was in a wheelchair. So he had to get insulin. He had that problem to begin with. But for over a month, he was sick. And I have many people, more than everybody in my pod is willing to attest to that. On a lot of times when he felt sick, we would complain to the COs, and they would just tell him, oh, tell him he has to sign up for sick call. The nurses would come with the medication. Oh, tell him to sign up for sick call tomorrow. They don't care here. They don't care about us human beings. They don't even see us as human beings. They see us, since we're immigrants, we're less than human to these people. They don't care about us at all.
That's Oscar Navarez-Diaz, who's also jailed at Otay Mesa Detention Center. For more on what happened to his friend Carlos Ernesto Escobar Mejia at the Otay Mesa Detention Center, we're joined by Ryan Devereaux, staff reporter at The Intercept, where he covered this tragic story in a piece headlined, ICE detainee who died at COVID-19 suffered horrifying neglect. Tell us more about who he was and how he died, Ryan.
Thank you for having me, Amy. Yeah, so Carlos Ernesto Escobar Mejia, as you mentioned, came from El Salvador in the 1980s when he was a teenager with his family, fleeing a civil war that had displaced roughly 1 million Salvadoran civilians, had led to the deaths of thousands of civilians. So he came to the United States as a refugee, and he had lived in this country for 40 years at the time that he was arrested in January of this year. His siblings had obtained citizenship, but Carlos had not. He had had some run-ins with the law in the 80s and 90s. I mean, his last conviction was in 93, as far as his former attorney says. And he'd sort of carried these demons of the Civil War with him into his life as a young man. But in the last decade and a half or so, had really turned his life around by all accounts. I mean, he continued to struggle. He was confined to a wheelchair following a work accident last year that led to the amputation of his right foot. But according to those who knew him, he had sort of built his life around providing for his sister. He found himself in Border Patrol custody early this year when he was receiving a ride from a friend outside of San Diego, and really being sent to Otay Mesa turned his life upside down. He struggled to find a wheelchair, and he happened to be landing in this detention center that was on a trajectory to become the sort of epicenter of coronavirus in ICE detention. And as the weeks went on, a request for bond was denied. He, like thousands of others who have been picked up by ICE under the Trump administration, was kept locked up even as this virus was unfolding. And according to the accounts of the men who were with him in his final days, they were doing everything that they possibly could to raise concerns about Carlos's deteriorating health condition. Carlos himself was raising concerns, and they say that those alarms that they rang fell on deaf ears, and that as a result, Carlos died. They believe that if action would have been taken sooner, if he would have been taken to a hospital early on, instead of being moved to a sort of unit meant for holding people suspected of COVID-19, if he would have been first just taken to a doctor, there's a chance he would have still been alive. And so these men who were with him are speaking out at great personal risk to try to correct the record on what happened here and what happened to this man who unfortunately became the first person to die in ICE custody, which was a reality that everybody who knows anything about ICE detention was warning about from the moment this virus became a reality that we were all going to have to contend with.
And Ryan, about the generalized conditions in these detention facilities, there have been instances where ICE has actually pepper sprayed or maced the detainees who were trying to seek safer conditions. Can you talk about that?
That's absolutely right. So we've seen a pattern over the last couple of months in detention centers around the country of people rising up and trying to make their voices heard, speaking out to journalists and advocacy organizations, saying that we're trapped in here, we feel forgotten, we're terrified that we aren't going to make it back to our families. People are staging hunger strikes. They're, like I said, talking to reporters. The response from the government and its private contracting partners, who by the way, make a lot of money off of this whole apparatus of detention, has been essentially repression, pepper spraying, tear gas, retaliation against reporters who are speaking to people in detention. That has been the way that ICE and the companies that it has worked with has largely responded to this situation. And it's worth keeping in mind that the population that we're talking about are folks being held on civil immigration violations. They're not being held for violating criminal law. They're not serving criminal sentences. The upshot of that, the significance of that is that the government could release these people at any time if it wanted to. It is choosing to continue to hold tens of thousands of people in jails. They'll call them detention centers, but what this is, in terms of the actual experience of it, is incarceration. ICE's detention numbers are lower than they've been in a long, long time, but we're still talking about more than 26,000 people who are being held.
In a moment, we're going to be joined by Erica Andiola, but I wanted to go quickly to the two other pieces that you have written about during the pandemic. In March, 2 men at Etowah County Detention Center in northern Alabama threatened to take their own lives because they feared people transferred there by ICE were COVID-19 positive, and they didn't want to be in the same pod or jail cell with them. A person held in the jail streamed the protest live on his Facebook page as the two men stood on a ledge with nooses made from sheets wrapped around their necks. They threatened to jump unless guards moved the new arrivals to a different unit. This is a clip of the video of the protest, which was recorded by the Washington Post.
They're not caring. They got 3 positive tested for the coronavirus in here with us. They brought them in here today while we were sleeping, and they not trying to let them out of here. We telling them, yo, y'all gotta take them out of here, or we gonna turn up in here. They threatening to shoot us with tasers and pellet guns.
Ryan Devereaux, you reported on the story headline, "Burials are cheaper than deportations," and you spoke to Kareem Golding and Tesfa Miller, prisoners at Etowah County Detention Center, who described the conditions at the jail. This is what they said.
This is the facility with the lowest standards in the U.S., right? It's a lot of issues that we've been dealing with beyond the coronavirus, prior to coronavirus.
We don't have no help. We're so far removed from everything else. It's like nobody noticed us. Nobody even know that we're here.
The entire system is working to keep this facility open because this is their money. This is small town USA, and this is just how these private contracts benefit your community. If you're not working here, you're working at Goodyear. Goodyear just closed down or laid people off. So other than that, you're either working at McDonald's or picking up paper on the side of the road.
Ryan, tell us more about these prisoners at Etowah County Detention Center and the ones that threatened to take their own life.
Yeah, I think what these men are trying to express is something that you're hearing from folks in detention centers all across the country, and that is the feeling of being forgotten in the midst of a global pandemic that's ripping through this country. And what they're describing is a system of detention and deportation that's been built up over the last several decades to the point that it is now, holding tens of thousands of people and refusing to release them, even as experts say that the Department of Homeland Security's own medical experts have said that these detention centers are a tinderbox. Those are their words for the spread of the coronavirus. So the men that I spoke to at Etowah County were really articulating the desperation that I just heard from the men who were detained with Carlos in San Diego on the other side of the country. I mean, this is the message that is coming out of these detention centers fairly consistently at this point.
We're also joined by Erica Andiola, who is the Chief Advocacy Officer for Raices Action, the advocacy arm for the Refugee Immigrant Center for Education and Legal Services. She's also the host of a new podcast series called Homeland Insecurity, which has just been launched. Welcome back to the show, Erica. Could you talk about the situation right now with these detention centers and Trump administration policy?
Yeah, I mean, a lot of us saw this coming. A lot of us saw this being a ticking bomb since the very beginning, when we started seeing the pandemic getting bigger and bigger in different communities. We knew that as soon as it got to detention centers, it was a matter of time before a lot of people, and in this case, there's been hundreds and hundreds of people now who have been have contracted COVID, and as we was mentioned before, we now have 2 deaths of Carlos and Santiago who have passed away. And unfortunately, the reason why we knew this was going to happen, as Ray says, the sister organization Raices Action, we have been hearing the stories of people since the very beginning of not being provided with the right equipment to protect themselves, not having masks, not having soap, many of them washing their hands with shampoo because they had nothing else to wash their hands with, not being able to socially distance. And so, it was just really a matter of time before this happened. And it's just, none of those folks, especially people who migrated seeking asylum, they did not, do anything to deserve a life sentence in a detention center.
And Erica, go ahead, Juan.
And Erica, this policy now of the Trump administration for even asylum seekers to immediately deport them back to their country, and actually got the backing of the head of the Centers for Disease Control as a public health issue?
That's right. They are using COVID-19 as a way to enact what they've been wanting to enact for a long time. We know that Steve Miller from the White House has had this agenda for, since they got elected into the White House. They wanted to end asylum. They have tried in different ways through Congress. They have tried to do it, through the executive powers. And now that COVID-19 is here and that there's a pandemic and people are afraid for their lives and their security, and now they're using it to deny people the right, to seek asylum in the U.S. And, I also want to mention that children are also being deported on their own. We know that for a fact. A lot of our attorneys actually work with children in detention. We have seen way less children now who are coming into the shelters, not because they're being released into the community to be with their families, but because they're being turned back to either Mexico or the countries that they migrated from, which is, imagine, there's literally children who are being sent back on their own without necessarily having the proper way of seeking asylum and the right that they have to seek asylum.
And I wanted to get your response, Erica, to Ryan, if you could tell us in just 30 seconds about this final story you did about New Rochelle, which was the epicenter in New York at first. But what happened right before it with ICE raids?
Literally the day before, Governor Cuomo sort of cordoned off New Rochelle as the epicenter of the epicenter in New York. ICE was in the community making arrests. They arrested a father in front of his wife and kids, took him into one of the detention centers that became one of the first sites of coronavirus outbreak in New York. And what I found in that reporting was that at the beginning of this year, the Trump administration, through ICE, was engaged in a really aggressive crackdown on so-called sanctuary cities, the political opponents of the Trump administration, and started filling ICE detention centers around the New York, New Jersey area with people from the community, folks who wouldn't have been arrested in the weeks or months prior as part of this crackdown. And those facilities where they were drawing people from the communities where the virus were spreading became the facilities that first saw outbreaks of the coronavirus.
Erica Andiola, if you could jump off of that and also talk about why you've started your new podcast, Homeland and Security, launching today.
Yeah, we're really excited to launch the podcast today. And the reason for that is because we've been wanting to tell the story of how DHS came about. I know that there's a lot of people who are skeptical, perhaps, about abolishing ICE or, just imagining what this country would have been like without DHS. And we want to tell the story of how at some point there was no DHS. At some point there was no ICE. And the reason why we're here was because of literally homeland insecurity, right? People who in this country who became so afraid after 9/11. And in some ways, I myself, as an undocumented immigrant, now a DACA recipient, became the enemy for an agency that now has turned all of their power and all of their, really their focus on people like myself, instead of really focusing on real threats like COVID. COVID-19 really showed that now DHS, instead of really focusing on what could be real threats to the homeland, ended up focusing on people like me. So I unpacked that history. We have released the
We're going to have to leave it there, but we will link to your new podcast, Erica Andiola, Chief Advocacy Officer for ISIS Action, her new podcast, Homeland Insecurity. And thanks so much to Ryan Devereaux of The Intercept. I'm Amy Goodman with Juan Gonzalez. Stay safe.